I am Dr. Srivatsa Subramanya. I am an orthopedic surgeon at Vasavi Hospital. Today I am going to talk about knee pain. Knee pain is probably the most common complaint why a patient visits a surgeon's office. And the most common cause of knee pain is osteoarthritis. So I am going to tell you about arthritis. If you have pain, swelling and stiffness in your joints, you may be suffering from osteoarthritis and it's probably time to visit your orthopedic surgeon. So what is arthritis? Let us understand the anatomy of the knee. Knee principally has two bones, one at the top and one at the bottom. Between the two bones, there is a layer of cushion inside each of the bones to make sure the bones don't touch each other. Arthritis is the wearing off of this cushion, and the cushion is called cartilage. As you can see here, this is the normal knee where the cushion is fine and there is a little bit of wear and tear of the cushion in this knee, and as you can see here, the cushion is mostly worn out. So when the cushion wears off, what happens? The bones start touching each other and we start experiencing pain, stiffness and swelling. So the cardinal symptoms of arthritis are pain, swelling and stiffness. Initially you may find that these symptoms trouble you only after a rigorous activity, but as and when the disease progresses, you start experiencing these symptoms on a daily basis. So there are predominantly two types of arthritis. One is primary osteoarthritis, the other secondary osteoarthritis. Most common cause of secondary osteoarthritis is rheumatoid arthritis. So initially, once you visit the surgeon, your surgeon would want to know if it is an osteoarthritis or a secondary osteoarthritis so that he can treat you properly. So he will run a few blood tests as well as do your x-rays to see the amount of wear and tear. However, the treatment of osteoarthritis depends on the severity of symptoms that you have been experiencing. If you are suffering from secondary osteoarthritis, the cause needs to be treated. Rheumatoid arthritis would need to be treated with medications, and medications for osteoarthritis primarily involves pain medications and occasional steroids. In addition to the medications, treatment in the initial stages involve activity modification, exercises and physiotherapy. However, when all the conservative measures fail, we tend to think about surgery. There are various surgeries that can be done for osteoarthritis. Arthroscopy is a keyhole surgery where camera is placed in the knee and the loose pieces that are causing pain are trimmed off. The other type of surgery we think of is the high tibial osteotomy, where the tibia bone is cut and made straight so that the pain reduces. The first two surgeries that I mentioned are usually performed in patients with younger age and then who like to stay active and play sports. When the patient is relatively older and the osteoarthritis is quite severe, disturbing your activities of daily living and not letting you sleep properly, then we consider doing a total knee replacement. What we do in knee replacement is this. This model depicts knee replacement. So as I mentioned before, osteoarthritis is the wearing off of the cartilage. So what we do in knee replacement, we chisel off the worn out cartilage and replace it with a cap on either side and a layer of plastic in between. So as you can see here, the bones don't touch each other anymore, and moreover your knee becomes straight. So what can we expect following a knee replacement surgery? You can walk the day of surgery but with a pair of crutches or a frame. The physiotherapist will train you for the next 3 or 4 weeks until you can walk independently. Most patients walk independently by about 4 to 6 weeks. You can climb stairs, you can walk as much as you like without pain, you can travel, you can do cycling, swimming and play golf, and sometimes patients do end up playing doubles tennis. So why we do knee replacement is to improve the quality of your life, and knee replacement certainly is a fairly successful procedure and helps you get back onto your feet.